It is obvious that the actual worldwide attention for non-communicable diseases is timely, but the NCD Alliance seems to offer a conflicted strategy. On the one hand, a vertical, disease-oriented approach is recommended, such as, for instance, developing a multi-drug combination for people at increased risk of cardiovascular disease. On the other hand, the NCD Alliance calls for strengthening of health systems, particularly primary health care. Yet their vision of primary care is limited and ambiguous. Primary care is seen as an opportunity for case finding for the disease-oriented programs, but is overlooked as the source of comprehensive care that integrates and coordinates the care for all health problems and engages individuals, families, and the community. It is obvious that we have learned a lot from the vertical disease-oriented programs. The evidence, however, suggests that better outcomes occur by addressing diseases through an integrated approach in a strong primary care system. The vertical disease-oriented programs for HIV-AIDS, malaria, tuberculosis and other infectious diseases, they foster duplication and inefficient use of resources. They produce gaps in the care of patients with multiple comorbidities, and they reduce the government capacity by pulling the best healthcare workers out of the public sector to focus on single diseases. Moreover, the vertical programs cause inequity for patients who do not have the right disease and leads to internal brain drain of health professionals. In 2009, the World Health Assembly has formulated a resolution 62.12, and urged member states to encourage that vertical programs include disease-specific programs are developed, integrated and implemented in the context of integrated primary health care. Horizontal primary health care provides the opportunity for integration and addresses the problem of inequity by allowing focus on non-communicable diseases while providing access to the care of other health problems, thereby avoiding the inequity by disease. It is clear that integrated primary care is essential for tackling non-communicable diseases. Chronic conditions, much more than infectious diseases, are influenced by patients' perceptions and behavior. Effective management of non-communicable diseases will require a shift from problem-oriented towards goal-oriented care. The long-term management of chronic conditions requires more than just access to affordable essential drugs in primary health care. It requires the empowerment of patients, a reduction of barriers to healthy lifestyles, and care that reflects the values of the individual patient. There is now consistent evidence of the effectiveness of primary health care in reducing hospital admissions related to non-communicable diseases. Multi-morbidity among those with non-communicable diseases has been shown to be better tackled in primary health care. In conclusion, the best answer to the challenge of non-communicable diseases is to promote people-centered care through investment in integrated primary care, including sufficient numbers of well-trained health professionals. We think that at least 50% of all health professions graduates should be trained for primary care. The NCD Alliance calculates that a global commitment of about $9 billion per year will be needed to pay for the priority interventions. Our advice is to add another $9 billion to strengthen local primary healthcare services in the same countries. As a result, millions of people will be able to have access to affordable, accessible, comprehensive and quality primary health care that addresses all conditions, including infectious diseases and non-communicable diseases.